government quarantine facilities or GQFs. These are places where people who are close contacts with people who are down with COVID-19 are quarantined. Basically, most are quarantined at home. For some people, home quarantine is not feasible, and therefore they're quarantined in a government quarantine facility like this. Also, people with recent travel history to Hubei are also quarantined. We have about 2,000 spaces in government quarantine facilities, and we want to make sure that everyone who's under quarantine is well taken care of. We appreciate the understanding of people who are quarantined. It's an important public health measure, and we appreciate the understanding and patience as they undergo quarantine. I also met the frontline officers here at this quarantine facility. They comprise our cleaning staff who have worked here for many years, the staff of CSC who take care of the administration of this place and look after this place well, also the CERTIS officers as well as the police officers who help to ensure that the integrity of the quarantine facility is maintained and that the needs of the persons under quarantine are taken care of. While under quarantine, they are provided, as you can see earlier, basic necessities, and if they need anything further, they can call the administrative staff, and they can also call MSF's hotline if they're under any distress whatsoever. So I'd like to thank our frontline officers, healthcare frontline officers. I'd like to thank the people who are operating this and other government quarantine facilities for being at the front line, at the forefront of our fight against COVID-19. Because of their hard work, their diligence, their vigilance, their persistence, and their unity, we have been able to keep COVID at the level that we are at the moment. But things are very fluid, they're very dynamic, they can change any time. And as you had seen from today's news, WHO has raised to the highest level of risk the COVID-19 situation. And the virus is in every continent except Antarctica. So whilst we work hard to keep Singapore safe, we need to always remain vigilant and brace ourselves if and when there might be further waves of infection. We then, of course, have to make sure we contain, we manage, and see what more we can do to take care of Singaporeans and take care of each other.